belief that is wholly untrue. There is no such thing as some candidates being chosen randomly to get all the questions. It's not true. When we talk about how the NCLEX is scored, remind me, we'll talk about how that myth gets started and what it actually means if you get all the questions, okay? I think it gets started because some people can't, but they can only conjure up that that's the reason they got all the questions. Every candidate gets a score of about 50%. Yes, that is true. When we talk about how the NCLEX is scored, I'm going to show you how and why. See, we're already learning things today. If a candidate is doing poorly in one category, NCLEX will keep giving them questions in that category. False. Untrue. When we talk about the NCLEX test plan, we're going to understand how the NCLEX decides what questions you get next. Candidates can take breaks during the exam as often as they want. True. 100% true. What's the catch, though? The time keeps ticking. But we're about to learn today why that doesn't matter. And you should map out your game and do it. Finally, running out of time is a common reason for NCLEX failure. False. Not a common cause of NCLEX failure. In fact, in the data we're going to look at, 0% of CSUP candidates ran out of time. It's actually really rare to run out of time. We're going to go over that data too. Oh, see, we didn't do well, but that's good. That means that I have your attention. And I'm trying to decide which way I want to show this. I'll try to do it this way. Okay. You can use the QR code to access some of the data from the National Council of State Boards of Nursing. The National Council of State Boards of Nursing are the nice people that bring you the NCLEX. It is an organization that includes every state board of nursing, okay? But it is also an organization that has very smart people, statisticians, exam experts that figure out not only what is on your exam, but what your exam looks like, okay? Anybody have any idea how it gets decided what topics are on the NCLEX? Well, I mean, that there is an enormous pool of questions, and the National Council will not tell us how many are in there, but it's more than you can count. Okay. How do they decide what question topics get added to the pool?
Like current events, states problems.
It is kind of current events. So every 3 years prior to the change of the test plan, every 3 years they go out and survey nurses who are in their first year of practice. Okay. Where do you guess that most nurses, new grad nurses, are during their first year of practice? What kind of settings? They're mostly in acute care. They're mostly in acute care. So you will see a lot of questions that are based in acute care. Not all of them, but that's just where a lot of the folks are that are new grads. Okay. They go around and they not only survey them to ask them what they think, they send people to go follow them around to see how they spend their time. So it's not only the topics, it's also the percent of the test plan that you're going to get. So if the average nurse in the first year spends 6% of their time doing pharmacology, it's more than that. Then 6% of the exam is going to be about pharmacoparental therapies. Does that make sense? They didn't just make it up. Every 3 years they affirm it. Now the good news is for you guys are going to be on the new test plan. Who's nervous about that? It's almost identical to the current test plan. The difficulty is the same. The test plan, like the blueprint's the same. Don't worry about it. You're fine. you're fine. So let's talk a little bit more about it. Sorry, I'm going to pace a lot. The NCLEX test plan. We're not going to go to the link. You can go to it here. But first things first, the minimum a person can get is 80 questions. Or, yeah, 85 questions. How many of those are scored? How many of those are counts toward your performance? 70 now. Used to be 60. 70 items, because on every NCLEX, there are 15 non-counting items. They are experimental items that the NCLEX is gathering data on to be able to put them in the pool. These items do not announce themselves to you. You have no idea which ones they are. Okay? None. The maximum you can get is 150 items. Be happy. The pandemic did that for you. It used to be 265.
Oh, my God.
Uh-huh. And you used to get 6 hours to get 265. Now you get 5 hours to get as many as 150. It's more than enough time. We're going to go over some stats about that later. It's more than enough time. All right. When they started talking about the next gen items, all nursing faculty everywhere freaked out, because when they first started talking to us about it about 5 years ago, we thought the whole exam was going to be that. No. You're going to get about 3 next gen case studies. Those are the ones that have like the highlight which thing I got to pay attention to in an R, and it builds on itself. And it has 5 or 6 questions in it, and it's going to build. You'll get about 3 of those. You can count them on. It's not the full test. Most of your test is still going to be standard multiple choice, or everybody's favorite, select all the apply, multiple choice. Here's the other good thing. The NCLEX is keeping for your blueprint what they adopted in the last update, which is that you get partial credit on select all that apply items. It used to be that you had to get it all or you got none. Not true anymore. That single change was responsible for the spike, I think, the spike in pass rates that happened a couple of years ago. That has since started to fall. We're going to talk about why. I need to just move this out here. It's making me crazy.
Can I help you with the mouse?
I just want the keyboard. Computer adaptive. What does computer adaptive mean? Anybody got an idea? Did you ever take a computer adaptive test in H12? Anybody? Okay. Computer adaptive means it didn't write a test and just give it to you. It is determining what question to give you next based on the questions you have already answered. This is why you cannot go backwards on the NCLEX. You cannot go backwards. This is also about nursing. Mr. Jones, I'm so sorry. I know that I gave you propranolol an hour ago, but I've thought about it a little bit more, and I would like to change my mind. I shouldn't have given it, and please cough it up now. You can't do that in nursing, so you can't do it on the NCLEX. NCLEX wants you to make a decision and move on. Computer adaptive. It also allows the NCLEX the opportunity to determine your ability without asking you 3 days of questions like I had to do. Okay? That's how they got it down to 150. Let's first talk about the categories, and we'll come back around to scoring. When you look at these categories, I want you to notice what you don't see. What you do not see is cardiac, respiratory, pediatric, labor and delivery. You don't see a lot of the ways that we structure content in nursing school. So it's going to force you to think in a different way, kind of turn everything 45 degrees and review. That's okay. You can do that. Integrated processes are just, this is all on the website. This is all on their website in the test plan booklet. Integrated processes are just things that are woven throughout all questions in all categories. They assume that you care and that you are caring and you are rendering care that is caring. Okay? They assume that you will use good clinical judgment to determine what to do. They assume you will use the nursing process to figure out what to do. Okay? Let's look at this graphically. Remember what I said about the practice analysis? These percentages did not come out of thin air. This came from the most recent practice analysis, and they figured out that about 18% of a new grad's time is spent on management of care. That's assignment, delegation, prioritization, all the things that you just love. Like, here's 4 right answers. What do you do first? That kind of reasoning. Okay. 13% on safety and infection prevention. All right. My favorite kinds of questions about infection control are the ones that you hate. Like, the nurse goes into the room wearing gloves, a gown, and a mask. What disease does the patient have? Okay. Physiological adaptation is the section that's going to look most like the questions you've had in nursing school. It's more disease processes. What does the treatment look like? How do you know if the treatment is working? Pharm and parenteral therapies is everything from medications to blood transfusions to IV therapies, TPN. Basic care and comfort. It's the stuff you learned in the first semester that you thought you knew until somebody asks you, how do you teach crutch walking? And you're like, oh, I don't know. I don't know. Psychosocial integrity. This is an easy one to master because a lot of it is about therapeutic communication. I've had many students tell me that therapeutic communication, the right answer on the test, is the one that you would never say in real life. That's maybe not true. Because therapeutic communication works on you even if you don't want it to. I had a psych colleague that, I would be talking and I would be frustrated. She'd say, well, what would you want to happen from this situation? I'm like, shut up, stop therapizing me. Health promotion and maintenance, it's a lot of age and stage kind of stuff, but there's also prevention stuff in there. Reduction of risk. My favorite kinds of reduction of risk questions are figure out which one of these patients is at the highest risk. And they've got all of these risk factors. You got to figure out who has the most of them. Those are fun, aren't they? You're like, I don't know. I'm just trying to figure it out. But at the bottom, it talks about these numbers on this chart, plus 3% or minus 3% from that number. Notice that that matches up here. When I say that it is false, that the NCLEX is going to keep giving you questions in a category where you're not doing well, it's because of this. Your NCLEX cannot give you more than 21% of your questions in management of care. It can't do it. It has to stay in the test plan. Has to stay in the test plan. Okay. It has to give you at least 6% of your questions in basic care and comfort. You're like, oh man, I missed the crutch walking question. It's going to keep asking me about crutch walking. Well, you might get more than one, but it's probably an accident. All right. It has to adhere to this blueprint. Okay. I'm not going to spend a ton of time on this because you're going to get this in your NCLEX review.
But the bulk of your test is still going to be multiple choice and multiple select. I've been teaching NCLEX success for about 18 years. For about the last 10 of those, students and graduates have been telling me that as much as half of their test was select all apply. You're just going to have to make peace with it. Make peace with it. It's going to happen. And when you start to get into your Kaplan strategies, you're going to learn strategies for how to manage those kinds of questions. Okay. But you also have drag and drop. Drag and drop tend to be like put things in order. Put these patients in order of risk. Put this procedure in order of steps. Put the patients in order in which you're going to see them based on acuity or priority. That kind of thing. Matrix grid, or like I've got a whole grid and I'm going to have to make an answer in all of them. That tends to be part of next gen things. Highlighting is a big deal. Highlighting is where you literally take the highlighter and it'll say, here's a page from the drug reference guide. Highlight the part that makes you not want to give this drug to this patient. You can't highlight all of it. Some of you I know, that if we gave you paper tests, you would highlight 90% of what was on the page. Well, it can't all be important. It can't all be important. So we're going to learn how to focus in on that more. Bow tie questions are specifically a next gen type where you're trying to, you start big, go to the middle, go. We're just going to have to practice them. Have you guys had any exposure to bow tie questions? Yeah. Okay, good. Trends are also like, I'm going to give you some data graphically, like here's the patient's flow sheet. And you have to make some interpretations based on their trends in their vital signs, for example, or trends in their labs. Again, tend to be next gen case study items. All right, let's talk again about scoring. Look, she put a line up there. A line. What does the line mean? This line represents the passing standard. Okay. The passing standard is currently and will stay 0.00 logits. Like, the heck is a logit? They didn't teach me about logits and stats. No, they didn't. Don't worry about it. Let's think of it as a level of difficulty for the item. So when you get an item on your NCLEX, it has been given thousands of times, either as an experimental question or as an operational item. And they know based on performance of that question, how difficult the question is. You think a question is difficult if you don't know it, or if it's farm. That does not make it a difficult question, okay? NCLEX determines difficulty in a different way. One of the ways it looks at it is what type of item is it? If it is a knowledge level question, the signs and symptoms of digitoxicity are, that is not a passing level item. It's not. If you just have to recognize the signs and symptoms of digitoxicity, not a passing level item. For the most part, if you could have answered the question by a single line on a note card, not a passing level question. Passing level items on the NCLEX start at that application level and move into the analysis level. It's your patient has these symptoms. Here are all the patient's meds. What are you going to do about it? Those are passing level items. Okay. Isn't that fun? The very first question you get on the NCLEX is going to be right around that line of minimum competency, the passing line. Okay. Remember, this is a computer adaptive test. So if you get that one right, then what happens? The next one is harder. So when you get it right, the next, I don't know if it's going to let me do that. That's all right. The next one is a little harder. If you get that one right, the next one is a little harder. And if you miss the next one is a little easier. Not easier based on what you think hard and easy is, but based on the logits that are attached to the difficulty of that item. The computer keeps doing this your whole test. What is it looking for? Anybody know? Yes, it's looking for the line. How does it do that? Okay, it is looking to see what is the difficulty level where you are getting about half the questions right and about half the questions wrong. It's going to push the difficulty up and down until you're getting about a 50%. You do not pass the NCLEX based on how many you get right or wrong. It is about the difficulty level of the ones that you get right and wrong. If your average level of difficulty where you're getting about half right and half wrong is above this line, you pass. If it's below that line, you fail. If it's skirting the line, going a little bit up and then a little bit back down, what does the computer keep doing? Giving you more questions. Because it's trying to figure it out. It's trying to figure out with a 95% confidence interval. So like every question it gets, it is trying to guess what's the difficulty level I think that they can get on this one. What's the difficulty level? And that band of could be questions anywhere within here starts to shrink as the test goes on, as it gets more and more confident. If that whole band of confidence gets up above the line, your computer shuts off and you're done. If it gets fully below the line after you've hit the minimum number of items, it shuts off and you have failed. If it's not sure, it's going to keep giving you questions. Okay. People that get all the questions, that's what's happening to them. They're not definitively above or below the line. And the computer's still trying to find it. All right. What that means is if the computer is still giving you questions, you can still pass. We're going to come back to that a couple of times. But there's a couple of other scenarios too. Most candidates are scored the way that I just described, where they're taking questions and it finally figures out within 95% certainty, hey, I know where their ability is because when I give them items, I'm able to accurately predict what difficulty to give them. They're getting it right and it's above the line or it's below the line and the computer shuts off. It can shut off anywhere between 85 and 150. It's not one or the other. But here's what nursing students want to think in their brain. They're sitting there and they have prepared for the minimum number of questions. And they tell themselves when it clicks over to 86, 90, 95, like I failed. It's already been determined. I have failed. And they silently freak out there in their little chair in the Pearson View Center. I had a student, she was an honor student, wonderful student. Back in the day, I told you it was 265 was the maximum. 75 was the minimum then. When the computer clicked to 76, she was like, well, that's it. I failed. Because everybody passes in 75. No, they didn't, but she thought so. She sat there and cried in her seat and just kept clicking to 265. And she failed. If she had kept herself together, she would have passed. We're going to come back to this idea. Okay. If you get to the maximum length exam, so you've taken all 150 questions, How does the computer figure out if you have passed or failed? What do we think final ability estimate means?
Extremely hard.
Not necessarily. Basically, if you're above the line at the end, you're gonna pass, and if you were below the line at the end, you're gonna fail. Okay, that's basically what that means, because you were so close the whole time. That's how you got all the questions. So you gotta keep your wits about you. Scenario number 3 almost never happens. Usually around 1% of candidates, including internationally trained candidates who didn't even go to school in the US. Very few people run out of time. But if you do, if you have not answered that minimum number of items, then you're not going to pass. Okay? Because it has to have that minimum number to be able to calculate a score for you. If you're over that amount, it's going to look at, it used to only look at the last 60 items that you answered. It now looks at all of them that you answered. And it figures out if your score is above the passing standard. Basically, it's going to look at everything. It's going to draw a line, your 50-50 line. If your line is above the line, you pass. Your line is below the line, you don't pass. Can you pass if you get all the items? Absolutely. And graduates from this program have done that, as we will see. You got to keep your wits about you, people. Keep your wits about you. If the computer is still giving you questions, you can still pass. I want you to hear my voice in your head as you were taking your test. Repeat it as a mantra, and we're going to train for this. Training for this is super important. Let's go over some performance from 2024-25. Okay, I only pulled data from basic track students. I left the accelerated out. Okay. Let me tell you what you're looking at. So we are the orange bars on the left. Okay. Colorado is the green bar. BSN only, no ABN, is the yellow bar. And the United States is the red bar. Okay. So in 2024, 2025, basically that academic year, which doesn't necessarily represent graduates during that year because it's a little bit delayed when they test. 88% passed NCLEX the first time. Okay. Now, how many passed the second time? Pretty much everybody. Right? We're sitting around the average nationally. Let's talk about total test time in minutes. Those who passed took about 139 minutes for their test. The max is 300. People who did not pass took about 191. That's way less than 300. Can you see that for people who graduate from this program, running out of time is not an issue? Look at Colorado, BSN, and nationally. Running out of time is not an issue. It's not an issue. You have time to consider each question carefully and use the strategies you're going to learn in your Kaplan review. Percentage of candidates who took the minimum number of items. Only 2/3. Even of the people who passed got the minimum number of items. So stop telling yourself that you've got to get the minimum number of items. Okay? Nobody in this sample who failed got the minimum number of items. So nobody crashed and burned so badly that they had already failed in the minimum number of items. All right. Average number of questions taken. Of those who passed from this program, about 98 average number, they got about 98 questions. If they passed, notice what the failures got. That's the average. What does that mean to you? That every single person in this sample from our program who failed got all the items. They were within 1 or 2 questions of passing. All of them. All of them. What does that mean? It means this program is giving you plenty of preparation to pass the test. This probably had to do not with how much they knew, but how they managed the test taking experience. We're going to talk a little bit about that. Percentage of candidates who got all of the questions. How many who passed in this sample got all the questions? 12%. You can get all the questions and pass. You can. But everybody that failed got all the questions. If the computer is still giving you questions, you can still pass the test. Say to yourself, if the computer is still giving me questions, I can still pass. That's going to be your mantra. All right. Let's talk about some key strategies for success. You don't have to out yourself, but go ahead and raise your hand if you feel bold. How many of you promised yourselves that over the winter break, you were going to go back to all of your notes, starting at farm, and review them? Who did that? None people did that. Here's the good news. I don't want you to do that. It's not fruitful, it's not useful, and it will not help you prepare. It's going to make you more anxious about all the things you didn't remember. Okay? I'm going to suggest some different things to you instead. Okay? You have got to train your mind and your behind for 5 hours, 150 items. If you are the person, okay, I'm not going to ask people to point, but usually people point at this. There are some jackrabbits in this room who cannot stand to have a test in front of them more than 2.5 minutes. And they race through and they are rummaging through their backpack and going out the door. And if you are a slow and steady wins the race person, you're like, oh, I hate them. They're no pointing. Okay. Jackrabbits, you've got to train your mind and your behind for 5 hours and 150 minutes. Slow and steady wins the race. You've got to train your mind and your behind for 150 items and 5 hours. Everybody needs to train for the maximum. This is not a sprint. It is a marathon. If it shuts off sooner, yay. By the way, nothing can prepare you for a blue screen of death. You're going to be like, ah, you're geared up for another question. It just shuts off. First thing your brain says is, I failed. I failed. And you're on allnurses.com trying to figure out how to trick it and see if you pass. Don't do any of the things they tell you. It's going to cost you money. Doesn't work. The Pearson VUE trick. Oh, just try to register again. And if you pass, it won't let you. Not true. They closed that loop years ago. Don't do it. Don't do it.
Can't you check for your license?
Yeah.
It won't pop up for a couple days. You're going to have your result by then. Okay. Oh, by the way, you don't want other people, Deanna, trolling for your license either.
They probably for you.
Okay, no, listen. Listen. I know I'm old and you're like, I don't believe you. Don't tell people when you're testing. Don't put it on your socials. Don't do it because the well-wishers are going to come out. Oh, girl, you got this. You're so smart. Oh, you're gonna be fine. Get RN. That feels like pressure. Pressure. You don't want pressure. You want cone of silence and Zen, serenity now. That's what you want. Okay. Let's talk first about preparing for content. The best way to prepare for NCLEX or any other standardized test is to do practice questions of the type that you are going to see on that test. Studying content does not improve standardized test scores. It doesn't. But that doesn't mean that there's no studying that you have to do. Do a ton of practice questions, and in this class, you're going to have to. But you need to don't just look at your score and go, oh, great, and move on. You need to be reviewing every question that you did as a practice question and figuring out why you got it right and why you got it wrong. And what, because sometimes you get things right accidentally or for the wrong reason. So don't just look at the ones you missed, review all of your tests. And I want you to make a list of things you need to look up again. Don't go crazy. I know what happens. You're going to miss a question because you could not remember what's a normal heart rate for a neonate. So what you want to write on your list to look up is normal heart rate neonate, not vital signs. If you can't remember a normal hemoglobin for an adult man, don't write down on your list CBC. Because next thing you know, you're in there studying, you're shifting to the left and you're shifting to the right with the white count and you're confused and it's been hours. Let your questions tell you what you don't know and review only those things. Move on. But you got to be disciplined about making some time for that because people are pretty good about making their list and then they let their list stack up to like 5 pages of things and get overwhelmed and just, watch TikTok videos. Oh, but I got a Snapchat and I've got a streak. My daughter's 24. I get it. I get it. Now, here's where most people struggle. You have to spend as much time preparing for the test taking experience as you do for the content of the test. I'm going to ask you to try some things that you're going to hate. If you study all the time in your jammies, crisscross applesauce with your laptop on the couch or the sofa, you've got a cat in your lap, you've got snacks, you got your phone in one hand, you are not preparing for the test taking experience. You need to try to practice in a way that replicates the test. You might need to come up here to do it. Go sit in the library. You're wearing real pants. You're wearing shoes. You're sitting in a chair with your feet on the floor. And you're doing groups of questions at a time without stopping before you review them. You're going to hear this from your Kaplan people too. When you start getting into the Q bank, the question bank will let you do things in tutor mode or test mode. Tutor mode shows you if you got it right after each question. Don't do it. Because the NCLEX is not going to tell you whether or not you're getting it right. You're going to sit there and try to figure it out though. Oh, I think this question is harder than the last one. Oh, I think this question's easier. I'm failing. I'm failing. You don't know. Don't try to play that game. The NCLEX is not going to allow you to have anything in your mouth during the test. No lifesavers, no cough drops, no gum. You are not allowed to take your chapstick, your Vaseline lip therapy, your Carmex, none of it. You cannot have it. You cannot have it. You cannot have anything that makes noise. No zippers, no earrings that jangle, no bracelets. They are serious about maintaining quiet in the environment. Oh, and by the way, that's going to get you too. If you have always practiced listening to music or having videos on in the background, you know you got Smosh on there. You're just like, what is, some of you are like, what is Smosh? Others are Smosh Hospital is really funny. Anyway, you've got to practice in the quiet. They will give you noise canceling headphones if you ask for them. But if you're going to do that, I want you to practice wearing noise canceling headphones. That freaks me out. I feel like I'm in a sensory deprivation tank and I can't think. I need a little bit of chaos of wrestling and things around. I want you to practice in the replicated environment as often as possible. I want you to practice to the point where you know when you should take a break. The NCLEX is going to offer you a couple of breaks at standardized points that don't count against your time, but you don't have to wait for that. If most people, because of nursing school and the rest of their K-12 education, most people can do about 50 questions at a time before they start to decline. But for some of you, it's 25 or 30 or 75. Yep. 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 Yes. But here's the thing with breaks. You want to be super strategic about it because your time is still ticking and it takes time to check out of the room and to check back in. Because they're going to wand you and they're going to take your picture with the camera. The camera's on you the whole time. That's another thing you should do while you're practicing. Turn on a Zoom or a Teams meeting or something, record yourself the whole time so that you get used to it. It's awful. You'll hate it. But it'll be good for you. But you in your practice need to learn where is the point where I start missing or where I'm reading the same question 5 times because I can't pay attention anymore. You want to plan breaks about 5 or 10 questions before that. Because the research shows that every time you take a break, it resets your attention, not all the way to the top, but pretty good. But what students do is they just try to muscle through. Oh, I can get through 80 questions. I can get through. Don't do that. Train your mind and your behind and set your intention and your plan for 150 items, 5 hours. Some people take a break after every 50 minutes. Figure out where it is for you. And when you are reviewing your test, you're going to start to see it. You're going to start to see where, okay, this is where my attention started to slip. I should have taken a break. Practice doing your breaks. On the NCLEX, when you take a break, you are allowed to go to your locker. The locker is where you keep your snack, your beverage, whatever you need, except your phone. If you are unwise enough to take your phone in with you, they are going to put it in a sealed bag and put tape over it and have you put it in your locker. They're going to check that seal when you check out. And if it's opened, you just failed. They're serious. Leave your phone in your car. But you can take a snack with you. You can take some tissues with you. If you go on the National Council site, it's also in the Pearson View site. It'll show you the list of comfort items that are allowed that anybody can have. You don't have to ask. Okay. Practice with only things that are on that list and nothing that's not. You've got to put your phone away. But somebody might need me. They will still be there needing you in 30 minutes when you're practicing. Okay. Who's feeling better and who's feeling worse? Who's feeling better? Who's feeling worse? Okay. It's okay. It's okay. Knowledge is power. There is work to do. But the other advantage of doing this preparation is you figure out what you need to work on and you have time to work on it. You have time to work on it. You're sitting there now going, oh, I can't do it. I can't do it. Yes, you can. Everybody who graduates from this program graduates with enough knowledge to pass this test. Everybody. Work just as hard on managing the test taking experience, keeping your anxiety at a manageable level. Now, some of you have test anxiety and you're freaking out even thinking about the word test. Okay. I can't fix that part for you. If you need to go to the counseling center and work through some stuff, do that. If, a warning that comes from years of experience, if you and your provider decide you need some pharmacological assistance with your anxiety, don't try it for the first time on test day. That Xanax is not going to help you if you've never practiced with it. That beta blocker that just dropped your heart rate to 40, probably not going to help you either. Don't try it the first time on test day. Okay? You can do this. Every one of you can do this. I want you to recognize that you can do it. Peter's still giving you questions. You can still pass. All right. Questions? Yes. Absolutely. I will give it to you. And it's being recorded, but I'm probably like dancing in and out of the frame the whole time. I'm a pacer. What else? Yes. Oh, that's a really good question. So the question is, how long of a break should you count on taking? Kind of depends on what you need to do. Like I've had breastfeeding moms that need to go pump. They're going to take like a 20-minute break. Some people are just going to run to the bathroom and come back. They need 5 minutes. So figure that out for yourself too. You got to figure out what you're going to need to do during that time. Not an hour. Remember, the clock is ticking. Okay. But I say on average, most people take about 10. Yes. Oh, is there a Pearson View in Springs? Is that the closest one?
Yeah.
Springs. But thank you for asking that. Did you know that you can take your NCLEX in any Pearson View center in the world that offers NCLEX? You do not have, your body does not have to sit in the same state as where your license is coming from. If you have trouble getting a time that works for you in Springs, look in New Mexico, look in Denver, look around. I've known students that plan to do it a little further away. They go stay a couple days before. They study, they get a massage, stop studying at least the day before. You are not, like, how many questions could they possibly ask you about VTAC? You don't need to review it again right before your test. Give epi, everybody gives epi. It's fine, get on the chest. Okay, so you can go test anywhere you want to, if you can get there, yeah.
Do they have accommodations for the NCLEX?
Yes.
Okay.
So you can apply for accommodations. Pretty much any accommodation that you could have gotten in school, including extra time and separate testing, is available. It is a process to get it done. It is not automatic. That is listed on, I think it's on the Pearson View site. It might be on the NCLEX site, but Dr. Persons can help you.
How is the room set up?
No idea. Every
no,
test,
no, for the testing center?
every test center is different. But usually it's just going to be like cubicles with partitions between. Something else, and I didn't talk about this before, you don't get scratch paper. You get either a whiteboard or a laminated sheet of paper and a Sharpie for either one. There's no erasing. No erasing. It's about test security. So like when you fill up either your whiteboard or your laminated piece of paper, depending on what that test center does, you have to turn it in and get a fresh one. Most test centers don't let you brain dump before you start the test. Like, oh, I'm afraid I'm going to forget all these things. They give you lab values on the test now. You don't got to memorize that. Okay. They only use generic names for meds on the test now. So focus on that. Okay. What else? Yeah.
How soon after we graduate?
Okay, so after you graduate, there's a sequence of things that have to happen. First of all, we have to wait for the registrar to say you graduated and that you actually have a degree. Then we have to tell the state board, yes, they really completed. And then the state board has to finish processing your application before you get your authorization to test. That's going to be weeks, not days. Okay, so what's the average, Dr. Persons?
4 weeks. The first person is certificate on June.
Okay,
Because he was first, so he told everybody.
yeah, don't do that. I know. The other reason not to put it out there on your socials is everybody has in their brain their pecking order of where they are in the class. Oh, well, if they pass, I can pass. Or "Oh, they didn't pass, I will never pass. Okay, stop it. Stop it. Everybody's on their own journey. It's not a competition. But as soon as you get your authorization to test in your email, which by the way, you have to have a complete package in your site, your registration with the board. You're going to learn about all that. Schedule right away. Do not wait for the magical day that you feel ready to take the NCLEX. It's not coming. Nobody feels ready. You schedule a date, you work toward it. That's it. End of story. If for some reason you don't pass, there is a mandatory waiting period to be able to take it again. If you don't pass, please tell us because we want to help you prepare for the next time. We are not going, well, of course you didn't pass. We want to help you and we're happy to do so. Okay.
I would add something. So we have a PowerPoint that will show you guys how to make your state board. If you're already in DORA as CNA, it's the same account. Your CNA license will inactivate, your RN license will activate. That's the portal. But they will not release your transcripts here from the university if you have any outstanding bill, parking tickets, anything like that, until your degree confers and they send official transcripts to Santa test. So keep that in mind, like parking tickets, any kind of old university, they will not release your transcripts.
Yeah, you got down to that balance of $750 so you could register that, but it's still sitting there. It's got to be paid before the university is going to verify that
And
you
if you
graduate.
can't pay, for a month, no big deal. As soon as it pays, your degree confers, you go. No. You have students out to pay things down first.
But be aware of that in your job search. Because most people around here are not going to fire you if you don't pass. But they want you to have at least attempted before your start date. If you're starting in July, you need to try to test in June, right? But we're happy to help you with all of that, figuring all that stuff out too. Is anybody thinking about doing their initial licensure in a different state other than Colorado? Okay. Couple of ways to do that. You can either test here and then endorse your license over, or you can apply there first. But every state has a different rule. In general, though, you're going to have an address in that state to do your initial licensure in that state. For most candidates, it is faster to test here and endorse their license over to the new state. If it is a compact state, you can start there, but if your permanent address is moving there, they're going to make you transfer your license. Unless you work for like the VA, federal system, they don't care which state your license is from.
But
Yes.
if you test in another state, you're still getting your license in Colorado.
You are
endorsed.
getting your license for whoever you paid your money to and applied to get the license. It can be difficult, it's like, I know I'm not going to stay here. So sometimes it's a waiting game. You just have to wait a little bit and figure out what your situation is. If you're going to, I did my initial license, what?
No.
I did my initial licensure in California and I had to have an address in California. So my friend and I put her aunt's address because we stayed with her for a while. Is that what you, that's where we were living when we first moved there. It wasn't where I was by the time I took it. But yeah, it's harder. And California is not a compact state. You can't practice with your Colorado license there even temporarily. What else? You're gonna have more questions. It's okay. If my door is open, wander in.
But ask because I'm sure others have it. So if I can, I'm sure if you have that question, the whole class does.
Yep. Do you have like a questions discussion board in Blackboard?
Put it in. Yeah.
Put it in there. Let people answer. Stay away from allnurses.com and Reddit. Although Reddit's a little more informative, you can usually tell. All right, folks. Thank you, Dr. Brown.
So that was like gold for you all. So hope you took good notes. We'll clear that slide yet and I'll post it. And give you a quick 5-minute stretch break. We'll come back and we'll cover some things. The agency Blackboard has info about NCLEX. Let me update that and I'll show you guys that Wednesday. So there are a couple things you can start doing to make an account, but don't start. Let me talk to you about that Wednesday. But take 5 minutes to come back and then we'll get on with the topic. What's like accurate information.
Welcome. Be back.
Yes. Later. I didn't do
Yeah, and just see if you can get like a 3 hour, just to be safe. Yeah, and then, yeah, sounds good. And then, try to do that date if not possible, that one is flexible. Yeah. Because if you schedule it, you just want them to know it's gonna be a long time period. Yeah, get it scheduled and then tell them. And then we'll figure out if it's an issue, and I'll help you. If we go, I could just start, because I could put. Yeah, thanks for telling me. Yeah. Yeah. Yes, hi.
I've been having trouble getting the captain and I called them. They said they would get back to me. They could check.
Okay, and then you're with your cohort you started with, right?
Yeah.
And did they email it? Did you get an email with your info
No.
login? Okay. But you have contacted them?
I did contact them.
Okay.
I did email again. Didn't go through either. They said they'll get back to me.
Just do it one more time through the support and I'll see if there's anything on my end. I mean, this is good. Let me know. Okay, yeah, you're okay. There's nothing major yet, but it's been a week, so. Yes.
I see you got like a plan.
Yes.
Answer or like express.
I'll put it. Let's see.
Yeah. I tried. Yeah, it's
I felt real cold. Relaxed. You got.
Oh, yes, I'm just like, yeah, that's how I do it. Normally, I have my desk, my cat is sitting on, I have a church right now.
You know, it's in
Yeah, in my face.
and wrapped in a blanket.
Yep, yep. Yep, that's us.
Yep.
I do it. Okay, where's the sign-in sheet? Does anybody have that?
Got it.
Yep, and then sign it whoever didn't get it. Trina, can you tell everybody in the hall I'm gonna start, because they might have that same question. You can just tell her out there.
Oh, are you not? Because I don't know about or something. You can't see anything in class. Maybe I'll talk to persons, okay? We need to try. Class, yeah. Yeah. Okay, yeah, just do here, but you need to. No, I know. Get in with somebody so you're not, so you can see everything. Okay, thank you. Yes. Okay.
Like the last relative that it sucks to be all different. Yeah, so it's like, it's gonna keep going up these games.
For the last bit here. Let's go. Okay, I have a couple questions that came up on the break. There was a question about, can you start applying for jobs even if you don't have your NCLEX? I say start looking so you know what's out there. Some places will hire you before you graduate because they like want to get you in there, like those ACP positions, acute care partner. And, or what's it, acute care? Yes, care partner. Some. And, but look and see, some will not hire you until you graduate, but you're, as long as you're gonna, be testing, and some you have to have your test done. So I just say start looking. That's my advice. Start looking and see what's out there so you have an idea. And then if they'll take you ahead of time, start applying and go with that. Another thing was they want you to total your clinical hours. So you can look back on your transcript. Every 1 credit of clinical is 30 hours. So like 452 is what, 4 credit hours? So 4 times 3, that's 120. And then sim, let me get back up with sim. I think every credit of sim is 15 hours, but let me get back to you on that. So that counts towards clinical hours. So I'll get you an answer by Wednesday. But for now, you can start looking at anything with an L on your transcript. 30 times that credit hour is the number of clinical hours you did in that. And I believe sim is 15 per one, but I think it actually counts still as 30. So let me get you an answer for that on as far as sim, because sim counts towards your clinical hours. I think it actually might be the same 30. So if you have 0.5 of sim, it counts for 15 hours, but hold me on that and I'll get back with you Wednesday. Sound good? Okay, any major questions before I kind of jump in a little bit on electrolytes? Then we'll do the clinical reasoning also on Wednesday, but we'll continue with electrolyte and renal. What I want you to do is just for like take 1 minute. And you already know a lot of stuff, despite what you may think. I'm gonna grab my markers, but I want you to write down, we're starting guys, okay? Yeah. I want you to write down what you already know about sodium, potassium, magnesium, and calcium. Couple little things on each of them. I'll write it down. You already know stuff. Think life-threatening. Let's go with life-threatening. For these electrolytes, we're going to build on what you know. Just to yourself. So just brain dump, just real quick. Maybe 2-3 things on each, like that you know about those electrolytes that would be life-threatening. Major nursing considerations. Without looking it up, I should have told you. This is all from your own brain. Okay? And here's the test plan that Dean Morris referred to. Okay, that she had that QR code, but it's right here for you guys too. And we'll talk about that. Okay. Okay. What do you already know about sodium? What body system is sodium? Neuro. Good. That's how I remember it. Neuro. So if your patient's level is too high or too low, what are some things that you might see neurologically? Confusion, decreased level of consciousness. That was my seizures. Seizures, okay? So anything neurological, one of the #1 reasons for altered level of consciousness for patients can be hypo or hypernatremia, too high, hyper, or too low. So you'll always see that ordered. Altered level of consciousness. The #1 reason, anybody know? Think vital signs. What's the #1 reason for altered? Close. Hypoxia. Good. So just keep those things in mind. They're just good nursing knowledge. You walk in, your patient has an altered level of consciousness. Kind of the #1 reason is hypoxia. Then you're right. It could be low blood pressure.
For elderly, it's often infection or sepsis, but sodium is another neurological one. So good job, guys. Potassium, what's the big thing you worry about with potassium? Cardiac. And who else has issues with potassium? Patients. Good, diabetic, and what organ gets affected for them? Kidneys, yeah, so cardiac, don't forget renal, we'll talk about renal a lot on Wednesday also, but patients with renal issues, their potassium gets out of whack. So then what are you gonna monitor? Cardiac very closely. A good, NCLEX thing to know, your patient comes in with high potassium or a low potassium, hyperkalemia or hypokalemia. What's the first thing you're gonna do? Yeah, put them on a cardiac monitor. Very good job. Okay. And we'll talk about reasons for these too. Good. So EKG, because you want a 12-lead EKG, because that is going to be your best accurate diagnostic, but then telemetry is your other thing, because then you got one constant and then you've got that 12-lead EKG. Good job. Calcium. That also affects cardiac and muscle. We'll just kind of keep it basic for now, but cardiac and muscle. Magnesium. Say it again. Muscles can be muscle also. And then respiratory. We'll talk about this, but magnesium toxicity, that's where they get really slow respirations. We'll talk about that. But respiratory can be related to magnesium. I mean, there were 100 amazing things in that presentation, but I think one thing to keep in mind when you're taking that NCLEX is people want it to shut off at 85. You're like, okay, shut off at 85. But did you see that 1/3 of people passing at that, but they still go on to, 1/3 of people past 85 still pass. So I don't get in your mind when that computer doesn't shut off. I think that anxiety can really breed in you. And anxiety is a beast for the NCLEX. So like she said, getting some strategies. I'm big on breathing. We'll talk about that a different day, but just some breathing techniques to help you through that. Respiratory made me think of that. So this document, if you open the renal and fluid electrolyte folder, twice. This is from fundamentals. I created this in fundamentals for you guys way back when. That was a long time ago. Is that what you said? So this, I kind of updated it, but we're just going to track through this a little bit and then we'll kind of come back to this and apply it with renal. So just track with me and we're not going to, spend forever going through this, but it's just some main reminders. I know Dean Morris said you don't have to memorize normal values. I would try to get some of these in your head just for good nursing knowledge. So when the lab calls you with a critical and they're like, your patient's sodium's 120, you're like, what does that mean? So it's good for you to know what that is. And if in doubt, tell the lab, okay, tell me what the reference range is. But a few of these I think you just need to know and you probably already have them memorized. But sodium 135 to 145, potassium 3.5 to 5, and always go by your facility, but those are some of the parameters there. Those I really feel like just for good nursing, you want to get those in your head. And like we talked about with sodium, again, too high, too low, you're going to see some neurological things caused by dilution of fluid. We'll talk about this with renal, we'll talk about with endocrine, but if someone's overhydrated, it dilutes out the sodium. Do you guys remember that? If you have too much water, it dilutes out your sodium. If you're dehydrated, it's the opposite. Your sodium is going to be really high because it's concentrated. So some of those basics just keep you thinking clearly. Like again, NCLEX, your patient comes in severely dehydrated and having seizures. What lab do you want to look at? Sodium. Okay. So that's kind of a little clue of how that looks. Monitor neurostatus, seizures, and confusion. You guys did good. You got a lot of that. So. Potassium, we'll spend a bit on this. We'll talk about it more with renal, but your patients in renal failure, what do you think that potassium tends to do? Go high or low? High. Good. So if your kidneys are failing, kidney is how you excrete your potassium. So a patient in renal failure, they may be on that cardiac monitor. You're like, why are they on a cardiac monitor? Their kidneys are an issue. That's that critical thinking nurse. Again, caused by loop diuretics. Anytime your patient's on a diuretic, the question you're going to look for is assess potassium level. And like was mentioned, we're gonna really try to stick with knowing generic names of meds. So I always say Lasix, but what is it? Furosemide, okay? Bumetadine, Bumec, spironolactone. Those are some of those those diuretics that I want you to get in your head, because that you quickly want to recognize those, because you're going to give them every day of your nursing career in most settings where you work. This is a big one I want you to keep in mind. Diarrhea, we'll talk about it also in GI. But diarrhea, what happens to potassium if you have diarrhea? You lose potassium, okay? So the treatment for high potassium, what do you think it is? Kind of to induce diarrhea. And does anybody know what that med is? Lokelma, or it used to be polyester, K-exalate. So I'm gonna erase this a minute. I'm gonna write some interventions for hyperkalemia, because I want you to know these really well. You think a high potassium is deadly? Yes, absolutely. So hyperkalemia. Actually, I'll just open it up because I have it in the blackboard. So track with me a minute on that. We'll come back to this. This is huge, and I'm sure you know this. If you don't, I don't know you, and you're fired, and this will make you fail the NCLEX in your whole nursing career. If you bolus potassium, I know you, I'm sure you know that, but you never bolus potassium. If your patient is hypokalemic, it's always supplemented slow IV administration, like a little piggyback, or anymore they do oral meds. I'm sure you guys have seen this. Your patient's potassium's low, there's a protocol, they give them oral meds or IV, never IV push. Okay. I know you know that, but that's a huge safety thing. Okay. My chat is up here. Okay. Again, loop diuretics, vomiting, starvation, bulimia, diarrhea, you will see altered potassium with them. Patient comes in with diarrhea and you put your patient on a cardiac monitor. Your friends are like, why are you doing that? Because again, because of that cardiac effect of losing all the potassium. So hyper can be caused by muscle breakdown, renal failure, and potassium-sparing diuretics. Treatment, of course, potassium restriction. We'll talk about this in the fundamentals section, but I do know NCLEX does like to ask you what foods are high or low in potassium. Because if someone has renal failure, they have to be on a renal diet. We'll talk on that because those are important things. Again, high potassium foods, bananas, orange juice, and broccoli. So again, that's that next step of critical thinking. Your patient's in renal failure, what do they need to avoid? These foods, because you don't want to raise that potassium. Monitor EKG, fatal arrhythmias, lethargy, respiratory failure, all these things. So make sure you understand hypo, what causes it to go low, what causes it to go high. Potassium, I guarantee you'll have at least 2, maybe even 3 questions on potassium because it's just such an important one. There'll be application questions. Okay, track with me. I'm going to go back to Blackboard here, and we're going to talk about the interventions for hyperkalemia. I'm going to open this for you. This is in Saunders, the newer text. It had, just for fun, if you ever want to listen, Fluid and Electrolyte, it's a podcast. I think it's 30 minutes. I just put that for you guys. I'm not going to don't be like, this is the gold standard for testing or that, listen to me, take good notes. But this is good if you just are, you're weak on fluid electrolytes. If you have a drive and you want something, relaxing, put you to sleep, or before bed, if you need to sleep, listen to this. Okay, I'm going to open this up. Interventions for hyperkalemia, and let's talk about these a minute. Make sure you understand these well. These are things that you will see utilized. So hyperkalemia, high potassium, we've already done an EKG. I have them on a cardiac monitor. These are potential treatments for hyperkalemia. So subcutaneous insulin, monitor blood sugar. So if I'm going to give insulin, what do you know that insulin does to a blood sugar? Drops it. So you need to be ready to treat your patient for hypoglycemia. Like I said, on Kidsville, we would get adult overflow. Had an older lady come in with hyperkalemia. They had given her this bolus of insulin in the ED to get the potassium down because it moves potassium back in the cells, but nobody checked her blood sugar. And she came to us practically seizing with a blood sugar of 40. So if you are going to be giving insulin to treat hyperkalemia because that potassium pushes it back in the cells, you better watch watch their blood sugar. Give them some orange juice with that. But that's a true treatment you'll see in the ED. Anybody ever seen this done? Hey, do you want to share? Do you mind? What was it? Yeah, yeah, every hour blood sugar for 6 hours. Yeah, it's a valid treatment for high potassium. Okay. Anything to add to that? Yeah. D50? Yeah, I'll bring some D50 so you guys see. Yes, it is. Yeah, you want a large bore? I'll bring it just so you guys can see. It's this huge thing. Do you know where to find D50? Crash cart. Okay, good. It is good to know where that is. Good. The other one you'll see albuterol nebulized and monitor the heart rate because do you remember what albuterol does to a heart rate? Raises it. Good. And that's a weird thing, but albuterol with the beta and the transfer of the ions in that potassium goes into the cell. So it's a treatment for hyperkalemia. Anybody seen this done? So it's not albuterol's for asthma. We'll cover that a different topic. But this is again where we're using the drug for the side effect. And then finally, this one, Lokelma, ED nurse educator I had with me last summer was telling me this is the new drug. Used to be Kexalate, if you've ever heard of that. But this Lokelma sodium zirconium, you probably talked about this in 420, but this one induces diarrhea essentially to help you get rid of the potassium. And again, if you are going to induce diarrhea on somebody, be ready. But what do you want to make sure is functioning? Their bowels. You want to make sure their bowels. So listen to the bowel sounds prior. So this again, this is something you will see a lot in your nursing career, even, ED, on the floor, ICU, no matter where you work. And you guys kind of know how I teach. I teach to things I believe you're going to see, and this is a life-threatening thing if you don't know how to treat. And I might have an NCLEX question on it. You will have a Heather Brown question on this, so I wouldn't know this. Okay. Does that make sense? Anybody seen Lokelma given? It's like a packet, you just, add it to, anybody seen that given? Yeah, you're the renal, yeah. Do you want to share any more about it? Yeah, yeah, yeah. Albuterol ever utilized for not so much? Yeah, yeah. Sounds like insulin in this Lokelma, so good. Okay, let's see. We have about 5 more minutes. Let's just go through a couple other electrolytes on here and then I will let you guys be. Calcium, we already talked about this. If you remember from assessment, Chavostics and Trousseau sign, that kind of is good to keep in mind. I feel like that is something that is testable. That Chavostics for the cheek, twitches, or Trousseau when you do the blood pressure in their arm, and we had a patient that would come in with, she was bulimic, and she would end up in this tetany because her electrolytes were so off, potassium and calcium, and she would end up with that tetany from that. So those are some things you may see. And then again, those are for, just to remind you, hypo. And then what's your treatment? You're going to give calcium, okay? Calcium gluconate. And we'll talk about this more in other parts, but it is an antidote also. Anybody know what it's the antidote to? MAG, yes. So yes, you'll get that again in OB, but MAG toxicity, calcium gluconate. Also can be given with hyperkalemia, okay? Anybody watch The Pit? They had a patient with hyperkalemia and they gave calcium gluconate. And I was like, man, see? Oh, are you listening? I was like, what? But on The Pit, but they ended up giving calcium gluconate for hyperkalemia to stabilize the irritability of that. So maybe we could just watch episodes of The Pit like once a week for the, so I had a mild crush on him when he was on ER. That's maybe why I became a nurse. So, ER 20 years ago. Okay. Let's finish this out. Calcium, too high of calcium. Don't forget, we're still going to keep in mind cardiac. We'll talk about parathyroid and that because calcium with endocrine is big. Excess calcium, you have an increased risk for a kidney stone. And again, vitamin D and calcium, that you need vitamin D for calcium absorption. That's just a good reminder. How do you synthesize vitamin D? With the what? What do you need? Sunshine. Good. Again, monitor cardiac. I erased it, but calcium, keep that in mind with calcium. Let's do magnesium and then I'll let you guys be. Magnesium, again, muscle. That's kind of how I remember that. MM, muscle. Is your heart a muscle? Yes. To breathe, do you need muscles? Yes. So that kind of helps me remind that magnesium can affect your respirations. If we're talking about hypo, again, cardiac, monitor for torsades. Okay, remember torsades is that twisting on points. And so what's your treatment? If low magnesium's a problem, how do you treat it? Replace magnesium. Good. Oral or IV replacement. Okay, then this column, excess magnesium. Okay, of course, you're going to stop the magnesium, monitor respiratory status, monitor reflex, and then our antidote, calcium gluconate. So I'll add that to this document. Okay, I'm not going to go in depth on phosphorus, and then we'll kind of hit just some of these. Well, we'll do it now. These are just some reminders. Again, this is from fundamentals, but good reminders. And then we'll start on renal on Wednesday. But if you know your patient has renal failure, you better be looking at their basic metabolic panel, look at their electrolytes. We already talked about this, but fluid volume deficit, this is kind of just basic nursing 101. You can have a fluid volume deficit from vomiting, diarrhea, or lack of intake or blood loss. And you're going to see the blood pressure affected. We'll talk about this more Wednesday. In fluid volume excess, and then vomiting, GI, and diarrhea, all these things you want to be watching electrolytes. Intake and output 1-to-1 ratio. And keep this in mind. Sometimes, I don't know, you get to your senior year and you forget this, but isotonic, your 2 isotonic fluids, normal saline 0.9 and lactated ringers. Okay. Your patient's bleeding out. What are you going to give them? You think blood, but it takes a while to get blood. Type and cross and all that. These are your isotonics for a bolus. Okay. Okay, that was a little fluid electrolyte. We'll track on again Wednesday and build on that and focus on renal and do a little clinical judgment. But thank you for coming. It's good to see you. See you on Wednesday. Week 2, you're already in it. So you're already a little NCLEX prepared.